As we told you last week, a report from UC San Francisco's Benioff Homelessness and Housing Initiative has found California's homeless population is aging, with the proportion of unhoused Californians over the age of 50 now almost 5 times larger than it was in the mid-1990s. Dr. Margot Kushel, the director of the UCSF Benioff Homelessness and Housing Initiative and a professor of medicine at UC San Francisco, joins me now with more. Thank you. Nice to have somebody from the Bay Area. I didn't get to tell you this in the break, but that's where I was born, at UC Hospital. I'm from right there. Yeah, so it's good to have you tonight. Let's just start with the basics. For folks who didn't read your report, we talked about it last week at 6 o'clock here. What is the basic summary of it?
You know, we did this representative survey of all adults experiencing homelessness in California, and nearly half of single homeless adults, those are the adults not living with small children or not the very young adults, nearly half are now 50 and older. And of those who are 50 and older, 41% were never homeless, not even for one night before the age of 50. And, you know, we see these older adults falling into homelessness, really getting stuck there, staying in homelessness for a long time, longer than their younger peers, and just having extremely poor health. Lots of problems that we usually see in people in their 70s and 80s, even though most of these folks are in their 50s or early 60s. It really is the new face of homelessness, and it really just puts a different spin on what the problem is that we're dealing with.
Yeah, and this obviously all can be tied to cost of living, lack of affordable housing for so many people. And I really want to touch on the fact that they weren't homeless prior to being 50, and now here they are. So it wasn't like they've been living in their 20s and 30s and 40s and now into their 50s homeless. So now, the other interesting finding that you saw was once you are there after 50, it's harder to get out.
Yeah, we found, as you said, you know, nearly half, 41%, had never been homeless before the age of 50. And on all counts, these were sort of typical adults, low-wage workers who had worked their whole lives, who were living in the community and then just fell short of money for housing, which really is what is at the heart of all of this problem. Once people fell into homelessness, or whether they stayed homeless, once they were homeless over the age of 50, they were homeless for a long time. The median length of time homeless for those 50 and older was 25 months. That compares to 20 months for those less than 50.
Okay, so just over 2 years' time. So your report, you know, we want to talk about the report, but then we want to be able to offer solutions, because obviously here in LA County, it's a huge problem. It is the crisis, with tens of thousands of people on the streets every single night. So for local leaders who see this report, what are some of the takeaways? I'm looking at the policy recommendations that your study came out with, 6 policy recommendations. Let's talk a little bit about that.
Yeah, I mean, every route towards ending this crisis flows through housing. As you said at the top of the hour, you know, all this money spent on criminalization was not actually getting people into housing. There really is no way to end this crisis without housing, and specifically housing that is affordable and available for the lowest income households. We found that prior to becoming homeless, the median household income was $920 a month. These are people living on fixed incomes, on disability, on really meager pensions, and they really need housing that they can afford. We also note that we need to really intervene while people are homeless and make sure that those services are accessible to older adults. We find many people being turned away from shelter, or finding that any housing they could find, they couldn't get up the stairs, they couldn't get there. Lots of behavioral health needs, so lots of substance use and mental health problems, partially from the incredible trauma of homelessness, and partially if you have those problems, you're more likely to become homeless. So we need to make sure that we are really providing the services that this population needs to thrive in housing. We know that this population can be housed and housed successfully, but they need services wrapped around to keep them safe there and to help them thrive.
All right, to read the full report, it is titled Toward Dignity, Understanding Older Adult Homelessness. You can visit homelessness.ucsf.edu. Dr. Margot Kushel, appreciate all the work that you're doing there in the Bay Area, and we appreciate you being with me tonight at 6. Thanks.
Thanks so much for having me.